Sleep. Sleep plays a vital role in good health and well-being throughout your life. Getting enough quality sleep at the right times can help protect your mental and physical health, as well as improve your overall quality of life. Ongoing sleep difficulties can raise your risk for some chronic health problems.
Without a good night of sleep, with a sufficient number of sleep hours, we are at risk for major medical problems. And those include heart disease, such as high blood pressure, strokes, depression symptoms, chronic pain problems.
The most commonly diagnosed sleep problem at the Sleep Center is sleep apnea.
And obstructive sleep apnea is when there's a repetitive collapse of the upper airway that results in a poor flow of air, and often that results in carbon dioxide levels increasing in the body. Sometimes the oxygen levels drop, and ultimately it destabilizes our ability to maintain a good quality of sleep.
The importance of quality sleep is why the Kaweah Delta Sleep Disorders Center has made such a positive impact on the lives of so many people.
So the Kaweah Delta Sleep Center was established over 25 years ago. It is the oldest sleep center in the Central Valley. And in fact, it's the only accredited sleep center in Tulare County, accredited by the American Academy of Sleep Medicine. Meeting accreditation standards is not easy. You have to have very high quality staff, very high quality equipment, and all of our staff members are board certified polysomnographic technologists and respiratory therapists. So it's a very advanced sleep center. The type of testing we do here accommodates essentially almost every type of sleeping problem you can imagine.
The Kaweah Delta Sleep Disorders Center has 6 comfortable testing rooms available, and testing is conducted 7 nights a week. If a patient suspects they have a sleeping problem, they can see their physician and get a referral to the Sleep Center for testing. If you're coming to the Sleep Center for testing, here's a few things you need to know about the process. After being referred, you will be contacted by the Sleep Center and told when to check in at the lab and what paperwork to bring. Parking for the center is located across the street in the multi-use parking lot. Since testing takes place in the evening, when you arrive at the center, you'll need to ring the bell to be let in. You'll be greeted by a staff member at the door and given a quick orientation of the facility, then taken to your sleep room. There will be some paperwork to go over and forms to sign. You'll be given privacy so that you can change into your sleeping attire. Then a technologist will spend time with you, getting your history and answering any questions you may have. Next, you'll be taken to a special room and prepped for the sleep study. This consists primarily of having monitor leads attached to your body. Once the leads are connected, you'll go back to the sleep room where the tech will attach the leads to the monitoring equipment. The final step before the actual test is to calibrate the equipment, and once this is accomplished, the actual sleep study can begin.
Typically, the patient will have anywhere from 45 minutes to an hour, hour and a half to kind of settle in, relax. If they want to watch TV, they want to read a book, they want to get on their computer. We typically like to have lights off by 10 o'clock, 11 o'clock at the latest.
And other patients, if they're really that concerned, their physicians can prescribe them a sedative. Most of the sedatives, like Ambien, known as Zolpidem, or Lunesta, or some of the other FDA-approved hypnotic agents to help us sleep, those can be prescribed while they're asleep. That's when the technicians are monitoring them from a control room. And the technician is tapped into their brain waves when they're entering REM sleep, non-REM sleep. They're evaluating their oxygen, sometimes the carbon dioxide levels, heart rate, how their chest and abdomen rises and falls, leg movements. All of these are very necessary to help us establish a diagnosis.
If it's determined during testing that the patient has significant sleep-disordered breathing, the technologist will intervene with positive airway pressure therapy.
That's where we come in and we wake up the patient. We intervene with CPAP, which is the mask that goes over the nose. And at this point, it's already been determined that the patient has met criteria for CPAP testing. In other words, they're severe enough that we can intervene with CPAP on the first night. We then place the patient on CPAP. We acclimate them, let them have an opportunity to voice any concerns. We then ask them to go back to bed and try to go back to sleep for us, where we'll resume testing.
For other patients who have special needs, where really testing at the sleep center will be very complicated, we prefer home testing if it's feasible. And we do that frequently enough. If there are those patients who just have special needs or just are adamant about not sleeping outside of their house, often we can test them at home.
At the conclusion of your test, your results will be interpreted by a doctor, and their recommendations will be transmitted to your physician. This process will take approximately 2 weeks. Upon leaving the facility, you'll be instructed to contact your referring physician in 2 weeks' time to review the results and begin the next step in your treatment. This step is crucial. It is imperative that you understand you must take responsibility for this important step in your treatment. The Kaweah Delta Sleep Disorder Center, for over 25 years, helping patients achieve better health through quality, restful sleep.